Supriya Jayagopal. She'll be presenting a case of ancient Schwannoma. Is she here? Yeah. Next presenter will be Dr. Jayashree Chitti. Please be ready.
Good morning, everyone. I'll be presenting a rare case of infraorbital nerve schwannoma causing proptosis. Orbital schwannoma is a rare type of peripheral nerve sheath tumor that arises from hyperplasia of myelin-producing Schwann cells and varies in clinical presentation. About one-third of schwannoma cases occur in the head and neck area. It is also known to originate mainly in the auditory nerve. However, orbital schwannomas are rare and account for 1 to 4% of all orbital tumors. They are usually solitary with well-defined margins and usually presented with slow, progressive and painless mass which can cause ocular proptosis. In this case, we report a rare, benign, isolated case of schwannoma arising from the infraorbital nerve in a case who initially presented with a painless unilateral proptosis. Case details. Here is a 40-year-old man with a unremarkable systemic history, presented with outward protrusion of the right eye since 3 years, gradual in onset and progressive in nature, not associated with pain, diminution of vision, redness, double vision, inability to close the eyelids, and with no history of trauma or ocular surgeries. On examination, the right eye axial proptosis was noted with no visible orbital swelling or mass, no visible pulsation with normal skin of the eyelids. On palpating, fingers can be insinuated between the globe and the orbital rim, and no tenderness was noted. On the retropulsion test, the resistance was felt on pushing the globe backwards. On measuring the palpebral aperture using a Hertel's exophthalmometer, the axial measurements were 35 mm in the right eye and left eye it's 20 mm. MRI orbit was ordered that revealed a well circumscribed ovoid right intraorbital mass of 35 into 19 into 16 mm of intraconal location in the inferomedial quadrant, displacing the optic nerve superomedially and ocular globe anteriorly. It elicits an intermediate signal on T1 and high signal on T2 and flare with progressive and heterogeneous enhancement on post-contrast sequences. A provisional diagnosis of infraorbital nerve schwannoma was made and a surgical plan of tumor resection through the inferior transconjunctival fornicel approach under GA was planned. A well encapsulated grey white mass was removed and sent for histopathology, and the patient withstood the procedure well. Histopathology confirmed the diagnosis of ancient schwannoma showing Antony A and Antony B bodies. This is the MRI imaging. The first image shows a T2 image having a heterogeneous enhancement, and the second image showing T1 having a microcystic changes on T1, and the sagittal section shows coronal section shows intraconal location of the tumor, and as well as the coronal section, sagittal section. Sorry. This is the intraop picture. The first image is showing the intraop picture of intraconal shape. Cone-shaped mass, and histopathology showing compact Antony A cells and the loose Antony B area, confirming the diagnosis of schwannoma. On post-op day 1, the patient vision was 6/6 with normal color vision and contrast sensitivity. He had lid edema with conjunctival congestion. 1 month post-operatively, he had no recurrence but had right eye exotropia with no diplopia or limitation of extraocular movements and mild tingling sensation over the right cheek. What is unique in my case was infraorbital nerve schwannoma usually presents as a nodular cheek swelling, but this case reports as an orbital schwannoma. Prolonged progression of proptosis without visual loss or pain is unusual. Many orbital tumors present with acute symptoms or earlier visual impairment. MRI describes a well circumscribed ovoid and encapsulated mass which characterizes schwannoma. The tumor's location in the intraconal space, displacing the optic nerve superomedially, poses a challenge. The preserved vision postoperatively indicates that tumor grew slowly without compressing the nerve. The histopath strongly confirms schwannoma but is less common in orbital cases. Clinical implication. Prolonged painless proptosis requires detailed evaluation and raises suspicion of slow-growing orbital tumor. The tumor's proximity to the optic nerve requires a thorough surgical planning to avoid damage and reduces post-operative complications. Schwannoma is a benign tumor with minimal risk of recurrence if completely excised. A combined imaging and histopath aids in appropriate diagnosis, and regular post-op monitoring is essential to detect any complications or regrowth of the tumor. Take-home message, the combination of prolonged symptoms and preserved symptoms, despite optic nerve displacement and characteristic histology, makes this a unique case. Imaging is a key to diagnosis and surgical planning. Early diagnosis helps in planning an effective surgical approach, as orbital schwannoma can mimic other orbital tumors, and infraorbital nerve schwannoma can be a differential diagnosis in cases of slow progressive non-inflammatory proptosis. No financial interest, and thank you.
So nice presentation, a very typical schwannoma case. Just if you look at your scans, MRI, Dr. Praveen was just discussing, you look at those scans and that schwannoma is going to tell you I'm a schwannoma. So if you can just put on your scans again, you just see a very well circumscribed mass with just central, that variegated appearance that will pick up, clinch the diagnosis. Of course, the definitive diagnosis is your histopathology. The second thing is you should remember that nowadays we all are trying to go for minimally invasive surgeries. So what is important is don't breach the capsule, take it out in totality. So that is another take-home message, and most of these patients do very well. In fact, it's a nice tumor for an orbital surgeon, very nice, easy to take out. So you can just see in the center, just center that mark, that area, can you see those typical, so that's exactly what a schwannoma would look like. There is a peripheral enhancement, and in the center you can see those areas. So all schwannomas more or less they look like this. Thank you.
Very nice.